is no secret that the ongoing pandemic is pushing hospitals to their brink. The Omicron variant only making the staff shortages worse.
It's hard to get nursing staff. It's hard to get agency nurses. And there's almost no amount of money that you can pay to get some of the nurses to work an extra shift because they've been through a lot.
Well, the sheer number of patients also having an impact on people who don't have COVID, forcing delays to surgeries and other much-needed health care. Joining me this morning is Ed Young, staff writer at The Atlantic. He just wrote a piece about this very dire situation. One ER doctor in New Jersey told you, quote, "You don't want to be injured now." I mean, and Ed Young, this is just one example of what a physician told you. Don't want to be injured now because now is not the time to not forget to put your seatbelt on, right, or to walk near ladders. Give us a sense of what you're hearing.
Hospitals are overwhelmed, and I feel like that word has almost become a cliche. It doesn't quite describe the situation on the ground. Even before Omicron, hospitals were in a bad state. Droves of healthcare workers had quit over the last couple of years because of the cumulative traumas of the pandemic. The Delta variant was already pummeling hospitals again, and now Omicron, though less severe for individual patients, is proving catastrophic for the health system as large, just because it is flooding hospitals with so many very sick people. Healthcare workers are being pushed to the brink, and that is changing healthcare not just for COVID, but for everything, which is why emergency doctors have been telling me and other people who've asked them about things like driving safely, about accidents, about injuries. This is a really bad time if you want to get medical care for anything, let alone COVID, and that is the cost of our continued inability to control this virus.
And not that anyone has been downplaying Omicron. Obviously, it is very encouraging that it appears to be not as dire as the earlier variants are, not as severe. But you write in the piece, you say, here then is the most important difference, however, in this surge. It comes on the back of all the prior ones. COVID's burden is additive, and that is the danger that lies in Omicron, you say, from what you're hearing from all of your sources.
And also its extreme transmissibility. You know, yes, it may be less severe than Delta, but that doesn't make it a mild virus. It certainly doesn't offer comfort to the many people who will develop long COVID from mild infections, and it doesn't offer any solace for the healthcare system, which is still being inundated by a lot of sick people, some of whom are still severely ill. This has always been the problem with the pandemic, that the threat to the collective, to our society at large, is always greater than the threat to the individual, and that is still true with Omicron. It means that the choices that we're all making and the political inaction that we're seeing is going to bounce back to affect us as individuals when we stop being able to get the kind of medical care for any condition, let alone COVID, that we've come to expect. And this is what is happening right now. I'm not talking about the future. I'm talking about a healthcare system that is crumbling in slow motion before our eyes.
What does that say about the mental state, the emotional toll, not to mention the fact that so many healthcare workers are getting sick themselves? But we remember, and we all applauded physically and literally the healthcare workers early on in this pandemic. And 2 years in, it's going to take a lot more than just our thank you to get them through this. What is it that they need right now?
I think they need people to stay out of hospital, and that's not just through things like accidents and injuries, but in terms of COVID, it means stopping infections. We've become too blasé about letting the virus rip through our society, and the cost of that is our hospitals are being inundated. You're right that the toll of this is cumulative, and the healthcare workers have been dealing with this for 2 years now, and they can't take anymore. They are, every day, they are seeing the reality of the pandemic hitting them square in the face in their workplaces. And then everywhere else, they're seeing people live out the fantasy that it is all over. I don't know how we can expect people to continue to sacrifice for us when other people seem to be unwilling to sacrifice for them. People seem to believe that the pandemic is over, but our collective choices and the actions, or lack of actions from our political leaders mean that for healthcare workers, it is far from over and it is getting worse.
And alarmingly, many of them are leaving the field and industry altogether because of the burden that we've seen on them the last couple of years. Ed Yong, thank you.
And we'll
so
continue
much.
to do so.
And we'll continue
Thank
to. Oh,